Hi, everybody. My name is Dana Lay, and I'm the founder of wander.health. It's a medical concierge that connects travelers to English-speaking doctors that are vetted and reputable in different countries. So the worst thing that can happen when you're traveling abroad is getting sick or injured. Yet 40% of Americans do. As an avid traveler myself, I've been in situations where I've lost my contact lenses, broke my glasses, needed a prescription for antibiotics, and it is a pain to find a doctor that actually can see me and understand me. And actually, it's taken me a whole day to figure that out. And I figured, why not create something that everyone should be able to get the healthcare they need no matter where they are in the world? So currently, when people are traveling abroad and they are thinking about their healthcare, they purchase travel medical insurance. And so when you purchase travel medical insurance, you don't realize until you read the fine, small little print that says it's only for emergencies, or it's based off of what the insurer decides is an emergency. And once you do that, then you realize, wait, my insurance doesn't really cover me for any of the things that I had mentioned earlier, like my breaking my glasses or getting a prescription or anything like that. So now you have a member that had a poor customer experience and the insurer had to turn them away. And then you have a member that is actually willing to, and they have to, pay out of pocket to go to a doctor and find care in that different country with little to no assistance. So in this case, they're going around figuring out who to go to, what if they speak the same language, if they're available, if the price is reasonable, and they're struggling through this all alone. But what if we can help? What if wander.health actually helps the insurer put money in their pockets by passing them along to us, and we solve all these issues? Last year, approximately 81 million Americans actually traveled abroad, and 17 million ended up getting sick or injured and going to an urgent care in that particular foreign city. So what our focus is that we want to create partnerships and agreements with all these clinics around the world that feel more like what you're used to here at home. So you see here behind me are some of the clinics we've partnered with. We have over 430 English-speaking doctors in 6 different countries and growing. The market that we're operating in is the healthcare provider network management market. Globally, it's a $3.9 billion market, and half of it is actually international based. Now, we're a little bit different. We're building the first of its kind network for an American-based company for building an international provider network for Americans. So with the little players that are in the field, we believe if we take conservatively a 10% market share, that's about $200 million. And how our business model works is that we partner with the insurance company where they pay us an annual license fee. And with that annual license fee, it's generally about a 6-figure contract that is an ACV, which is an average contract value. Then, if they have any members that they can't cover in their policy because they only cover emergencies, generally, they can pass them on to us if it's a non-emergency situation. So then the individual actually books their appointment with us. They see how much things cost on the platform, and they pay us, and then we, wander.health, distribute part of the negotiated rate that we've already pre-negotiated with the clinic to the doctor, and then the remaining part, which could be up to 20% and more money into the insurance company's pockets, the booking fee. You'll see here also is that we have a very attractive LTV, lifetime value, and to CAC, customer acquisition cost, just making sure everyone knows what that means, ratio of 55 to 1. So we're currently $1,000 to expand our international provider network. We want to be in more cities, more countries, have more non-emergency specialties like dental and vision. Right now, we only have urgent care and one dental. And we have strong interest from insurance companies, and we're currently actually designing pilots with them. However, we do need funds to expand and operate those pilots. You'll see here on my left-hand side, these are companies that have built US-based provider networks, and they've been very successful in this space. Multiplan, one of the largest SPACs in this country. They IPO'd for $11 billion for creating ghost provider networks for all the US health insurance companies. CareLinx, they had 450,000 care providers in their network with a reported revenue of $5 million and sold for $65 million. And then Magellan Health, they got bought by a public company, and they only had 118,000 providers in the behavioral health space. And they sold for $2.2 billion. Pretty good. So we understand that there are some competitors in our space, and our competitors are building a database of international providers as well. However, we're different in three ways. One, we're fast. The network we currently have, we built it in 6 months as a bootstrap company. It took them 18 months with venture capital funding. Second, we're compliant. None of our other competitors we've seen has built a vetting framework where they're able to actually look at licensures, certifications to make sure that these doctors and clinics are legally able to operate. And then lastly, we're an American-based company made for Americans. A lot of our other competitors are really focused on the international markets, and what we're doing is creating this branding that really focused to us. Our team has over 40 years of healthcare experience combined. We even recruited somebody who worked for the US Department of State, and he has vetted clinics and doctors for the past 20 plus years and posted them on the US Embassy list. However, those lists are very static. They're not up to date. They're just a piece of paper. And what he's helping us do is actually be able to create this comprehensive working database that we can actually commercialize. I myself, as the founder, I've done this before. I've built a profitable international network of 60 plus hospitals and negotiated contracts between hospitals and multi-million-dollar contracts between hospitals and payers. So to recap, why us? We've hand-selected a network of international providers and clinics and doctors that are compliant, that offer same and next day availability, we've also negotiated rates with, along with we are constantly updating our database and our platform and building those strong relationships with them to ensure that we know the service is up to date and where the doctors are able to take on our members. And what we want to do for the individual, the person, is be able to help you navigate a convoluted foreign country's healthcare system. I invite anybody today who's interested in joining me on our vision on building a world that healthcare can be accessible to anyone, whoever you are or where you go. So feel free to talk to me after this presentation or reach out. Thank you.